the questions I'm asked often before patients have even come to a pain clinic is, when should I see a pain specialist? And in fact, often patients will make a comment after having been to a pain specialist, look, I really wish I'd come here years ago. And so I wanted to try and talk a little bit around this subject and give some information to viewers of what are the appropriate circumstances in which it would be useful to see a pain specialist. Now, obviously, there's a time zero when you first get the particular pain issue. Now, at that point, of course, you're not really thinking about, is this appropriate for me to go rush off and see a pain specialist who works in a pain clinic? You're more concerned of, why has this pain come? What is the cause of the pain? And what do we need to do to have this cause resolve? Because one assumes that when the cause resolves, then the pain resolves. And that's a logical way to approach the process. And in the vast majority of times, that's going to flow through to some treatment or natural resolution of the underlying problem so that the pain disappears, if you like, from the treatment or from its own accord. Now, that sort of process where you might be referred to a physiotherapist or another allied health professional, or you might be referred to your primary care practitioner, such a family medicine doctor, or you might be referred to a specialist, they're all focusing on, well, what has caused this pain? What do we need to do about actually resolving that issue? And that tends to be not a blinkered approach, but certainly a very focused approach. And perhaps it's the rare physician who is looking at holistically looking at what that pain is doing to that person at the same time as saying, where is this pain coming from and what do we need to do to make it go away? So it's almost like there's this inherent concept of, if you go do these things, A, B, and C, then the pain will take care of itself. So no one's actually dealing with the problem of the pain, they're only focusing on the issue, if you understand what I mean. So we need to understand that for severe pain, for pain that is distressing that individual, it's interrupting their sleep, so they're starting to get sleep deprived. They're losing the ability to turn up to work. They're getting irritable with friends and family members. Then we really should be thinking about assisting that person even if the pain is only 1 week old, 1 month old. We need to look at ways to improve that. And I think that's the kind of conversation you need to have with your primary care practitioner, for example, and bring to their attention that the pain is affecting you in these different areas, rather than simply suffering the condition until such time as it can go away. So those specialists are focused on, okay, is it an inflammation of the tendon? What do we need to do to resolve that particular condition? We know that when a condition has gone on for more than 3 months with ongoing pain symptoms, then we start to see that there are changes that occur not only in the peripheral tissue, if it was a carpal tunnel syndrome, for example, but there are changes that start to occur in the nervous system from the constant barrage of pain signals travelling from that body part up to the spinal cord and then up to the brainstem and of course then up to the brain. So with pain that is persisting beyond 3 months, the recommendations from international bodies such as the International Association for the Study of Pain, which is one of the primary societies in this area, is that pain that is distressing or disabling to an individual that has lasted longer than 3 months, that's a very good, valid reason to look at a referral to a pain clinic to be assessed by a pain physician in terms of what things can be offered. Now, it doesn't have to be an either-or scenario. It doesn't have to be, I must now abandon direct treatment, direct resolution of the condition. I must simply have management of the pain. It can be a continuum where 2 things are done at once, on parallel tracks, if you like. One is sourcing the underlying cause, aiming to treat that, resolve that. And then the other one is dealing with the pain, minimising the impact of the pain on that person's life. And there may be particular treatments in the pain clinic that are applicable to dampening down the intensity of that pain, or particular techniques that are important in terms of reducing the likelihood of that pain becoming chronic. So these things can occur in parallel. And obviously for somebody who's actually gone down a longer pathway of having persistent pain, where their pain's been going for more than 12 months, for example, that's a scenario where we know a high volume of those patients will have these disabilities or have these components of distress associated with the condition. And that is primarily treated in a pain clinic, for example. So those are sort of some rough guidelines to think about, that if you've had persistent pain for more than 3 months, not only are you within your right, it's ideal for you to approach your doctor and talk about a referral to a pain clinic. And that can become part of your healthcare team that are aiming to give you the best quality of health, the least amount of pain, and also as much chance as possible for resolving the underlying condition. So I hope that's been helpful in terms of setting some guidelines of when to ask for that type of referral.